Okay, please start.
Okay, right. Good afternoon to all the participants of this online one-week training program on an update on clinical pharmacology and forensic toxicology, organized by Department of Veterinary Pharmacology and Toxicology of Veterinary College, Bidar. We are into fourth day of this one-week long training program. Today we have one more renowned pharmacologist as a resource person who will be speaking on current trends and therapeutic management of mycotoxicosis of ruminants. It's my pleasure to introduce Dr. N.P. Sridhar, who is the guest speaker for today's lecture. He is working as professor and head, Department of Veterinary Pharmacology and Toxicology at Veterinary College, Shumaga, which is a constituent college of KV FSU Bidar. He is also having an additional charge of principal investigator and head of Obscure Disease Research Center, and its head campus is located in Shumaga. He obtained his graduation from Veterinary College Bidar, Masters from Veterinary College Bangalore, IVRI, and PhD from Veterinary College Bangalore. Before joining to COPSU, he served as a veterinary officer in the Department of Animal Husbandry and Veterinary Services for almost 13 years. And he mainly served in Malnad area, and during his service as a veterinary officer, he was a very renowned veterinarian in that area. He joined KVFSU in 2005. He has served as a major advisor for 26 MUSC students, and he has guided 6 PhD students. And he's having a very good hobby of writing articles in English as well as in Kannada. And he has already published 4 books in Kannada. And most of the veterinarians in Karnataka might have gone through his articles in newspapers. Every week you can find one or the other articles written by Dr. Sridhar Bhatt. He has handled 8 extramural projects at vast experience. The Academy of Science for Animal Welfare has awarded him fellowship. He is a fellow of Academy of Sciences for Animal Welfare, and he has received many medals. He has received UAS Gold Medal from UAS Bangalore. He has received Best Veterinarian Award from Karnataka Veterinary Association. He has received Best Kannada Agriculture Book Award from University of Agriculture Sciences GKVK for his book entitled Januvarugalli Vishabhade. And he is also he got one more award, Best Kannada Scientific Book Award by Karnataka Science and Technology Academy, Government of Karnataka, for his one more good Kannada book, that is Hainu Hannu. He has received many appreciation awards from the University of our KVFSU Bidar for getting many extramural funded projects. And he has been awarded with Best Paper Presentation Award from Indian Society of Veterinary Pharmacology and Toxicology, and Best Poster Presentation Award from Society of Toxicology, India. So, sir, it's our great pleasure to have you today for today's lecture. Now I request Dr. N.P. Sridhar, sir, to go ahead with his lecture.
Thank you, Dr. Shrikant Kulkarni, for your nice introduction. And today we will learn especially the mycotoxicosis, a burning field problem in field conditions, and the therapeutic measures, especially how we can go for the mycotoxicosis, especially the treatment remedial measures. So, shall I go ahead? Hello?
Yes, sir, please.
Okay. So, today I am going to tell the details about the current trends and therapeutic management of mycotoxicosis in case of the ruminants are concerned, because most of the time the mycotoxicosis is always focused at the poultry mycotoxicosis, and the mycotoxicosis is totally a neglected field in case of the ruminants are concerned, because they say and the people assume that the ruminants are very much what you call as resistant to the mycotoxins. Of course, it is true in case of aflatoxins, whereas for varieties of the other mycotoxins, the cattle are highly susceptible, which is not known to many of the persons. That's one of the important things. And the mycotoxins are the secondary metabolites of the toxicogenic fungi. and varieties of the fungi affecting the feed and the food ingredients, which cause adverse biological effects when consumed in sufficient quantities. Of course, we have observed that the cattle, majorly the buffaloes, do have very much susceptibility to the mycotoxicosis is concerned, and they affect very commonly in case of feed conditions. And also many ubiquitous genera and specific species of the toxic fungi are known to grow in the and produce their toxin when temperature, moisture and aerations are very much favorable. Means whenever especially we have seen the feed and fodder mycotoxicosis in case of the ruminants, because the ruminants always consume the fodder as the source of the energy and protein, and many times because of the high moisture content and also the low, what you call as the storage process, the fungi will attack, varieties of the fungi will attack the fodder. And it is the habit of the farmers that to put the such stale fodder to the particularly their cattle or the buffaloes. And ruminants are somehow less susceptible to the effects of the mycotoxins when compared to the monogastric animals are concerned. Especially poultry and monogastric animals are much more having susceptibility when compared to the ruminants, because rumen many of the mycotoxins, especially the aflatoxins, to some extent they get what you call as the detoxified to the greatest extent. Apart from this one, the common mycotoxins are the aflatoxins, and just I will give a very brief information about the mycotoxins because it's a very well dealt topic. Especially aflatoxicosis is a very great problem in case of the turkey. It is also called as the turkey X disease, and more than 1 million turkeys died in England in 1960s. Later it was named as the turkey S disease. The most studied mycotoxins are the aflatoxin B1, aflatoxin B2, AFG1, G2, M1 and M2. And the acrotoxin, it is also abbreviated as OTA, fuminosin B1, zearalenone, then vomitoxin or deoxynivalenol or diacetoxyskripenol and nivelol, epicidine, trichothecins and H2T, T2, etc. Many more mycotoxins are there, about more than 400 type of the mycotoxins are there. And among these things, the mycotoxins which are affecting the cattle are the many, especially the Aspergillus flavus, Fusarium, Penicillium, Pithomycosis, and Staphylococcus, Rhizopus, Rhizoctonia, Acrimonium, and many more mycotoxins are affecting the feed or fodder in one or the other way, and they secrete the secondary metabolites which are called as the mycotoxins. And these the reports of mycotoxins in the case of cattle in our country are very, very less, and many times it goes unnoticed. The mycotoxicosis of the ruminants goes unnoticed, and it is confused with so many other diseases. Maybe the mycotoxicosis, the symptoms are overlapping with one another, hence many times it goes unnoticed. Hence many times the veterinarians do confuse the mycotoxicosis, and the mycotoxicosis may also be pre-existing with some other infectious diseases or non-infectious diseases. And the toxic effects of the most important mycotoxins in the cattle are like this. The commonly occurring toxic mycotoxicosis is due to the aflatoxin, acrotoxin, fuminosin, zearalenone, and deoxynivalenol, and also the T2 type of the toxins are there in the cattle practice are concerned. So whereas the aflatoxin affects the immunological functions and rumen metabolism and decrease feeding efficiency in case of the cattle, and there is drastic reduction in the milk yield which goes many times unnoticed. Of course, as usual, it causes the liver damage and decrease feeding efficiency in case of the dairy cattle also. Whereas it is one of the hepatotoxic mycotoxin and also the immunosuppressive mycotoxins. As we know, in the other animals and the poultry, the same effects are being exhibited by these aflatoxins are concerned. And apart from this one, the mycotoxin, especially aflatoxins and its metabolites, are the residues of the milk. So it may be also of the dangerous thing to the human beings. And another thing is the aflatoxin is heat stable. It is not destroyed by the heat in which we are going to pasteurize the milk, or also the meat, we are going to boil it in 100 degree centigrade. And ochratoxin, it causes the kidney disease problem and the reduced milk yield. See, sometimes the reduced milk yield may attributed to the fungal infected fodder. Many times it goes unnoticed also. Whereas the fuminosin is causes reproductive disorders, negatively affect the function of the immunological, and many times these are going to suppress the immune system of the body and cause lesions in kidney and also in case of the liver. Zearalenone is causes the infertility. Many times it acts as the estrogen congener and causes the prolonged stress syndrome. Along with that, the deoxynivalenol. So this is also another important mycotoxin which causes hyperestrogenism. Many of the cases, cattle, we have seen that there is prolonged stress and animal becomes unproductive or repeat breeder. So this might be due to the occurrence of both of these mycotoxins, especially the zearalenone and deoxynivalenol. And also the acute gastrointestinal effect may be also be seen in case of such cattle. And of course, the gastrointestinal effects, the hemorrhages in the gastrointestinal tract, and also sometimes diarrhea may also be seen. Whereas the T2 toxin is one of the potent toxin. It causes acute hemorrhagic enteritis, and the drastic reduction in the feed intake, and because of this thing, because of the low feed inefficiency, there is drastic reduction in milk yield. Sometimes there is a marginal decrease in the milk yield also observed, which is also a greatest economical loss to the farmers. It happens in the many ways, and the more than 4,000 mycotoxins have been chemically identified as on date in the different parts of the world, especially starting from all these things. Aflatoxin, maybe zearalenone, maybe T2 toxin, or many more are there. The biological of the importance of this veterinary medical importance are only several mycotoxins, as we have already learned. And the awareness of the mycotoxicosis in the forage by dairy producers is greater today than several years ago, because the veterinarians and the farmers do know that feeding a stale or the fungal infected fodder causes the health problems in case of the ruminants also. Earlier, this was a totally neglected field, and now a lot of importance is given to administer a good quality feed or fodder to the ruminants are concerned. And the mycotoxin diagnosis kits are nowadays available. That's also one of the important reasons. And earlier, since they are in the ppb level or microgram level, it was very difficult to find the mycotoxins, especially in the blood or the feed or fodder ingredients. Now the kits are available. The methods like LCMS, MS or GC, and many times the HPLC methods can be used for the diagnosis of or the presence of the mycotoxins in a specific feed. And there is enhanced awareness about the mycotoxicosis. Of course, in India, this awareness it is not arrived. Even though there are acceptable daily intakes for varieties of the mycotoxin affected feed or fodder, in cattle, it is a totally neglected area. Hence, there is increased dairy production stress is there, and in recent years, there is inclement weather. That's also one of the things, because nowadays the weather, especially the raining and other things, are happening in inadvertent seasons. Now also the raining is happening, and because of this particular raining, the fodder is getting affected with that of the mycotoxins, not the mycotoxins, causing mycotoxin secreting fungi. So starting from Aspergillus and many more fungus are going to affect the particular fodder or feed or any eatable material which is offered to the cattle. Hence, one should be very careful to administer such what the feed which is affected with the fungi. And as on date, several mycotoxins may exist and diagnostic methods are not so consistent, even though there is diagnostic facilities available for the regular mycotoxins like aflatoxins, etc., which are having the poultry importance. Many times we will not get the standards, and treatment and control recommendations lack indeed research. And in India, a lot of research need to be done on individual feed and fodder so that we can go ahead in the mycotoxicosis diagnosis and treatment in case of the large animals, especially cattle. And field investigation have been associated and the mycotoxins with increased incidence of fresh cow problems, including this displaced organism. Then many times there may be ketosis, and sometimes the ROP or retention of the placenta may be due to the T2 toxin or the zearalenone and many more. And metritis, mastitis, and fatty livers, all these secondary complications may occur due to the mycotoxicosis is concerned. And dairy herds, they suffer a lot from the mycotoxicosis, but are associated with milk production losses and failure to respond to veterinary therapy and or the changes in the nutrition. Yes. The dairy herds to suffer from the mycotoxins to the greater extent, whereas they are associated with the decreased milk production. Once again, year end sometimes the stock root caused by the fusarium, it causes the what you call as the necrosis of the extremities, and many times the other fungi also causes the mycotoxicosis disease like the diplodia and many more. And the diseases sometimes they are attributed to something else, and later it may be diagnosed as the particularly the mycotoxicosis, because the most prevalent molds isolated from silage, this silage is very oftenly affected with the mycotoxins, and the species of the fungi which affect the silage are the mucor species, then penicillium species, aspergillus species, and monililla. So all these species will grow on the silage, and sometimes these stale or the rotten silage is offered to the cattle, then they suffer a lot. And apart from this one, Aspergillus flavus may produce aflatoxin as a failed mold, although it is clarified as the storage organism. Associated. The commonly diagnosed mycotoxins are the aflatoxin, which is produced by Aspergillus flavus, and everyone know that the aflatoxin is going to cause the disease in most of the species. And DON, or it's also known as deoxylevolol, or the vomitoxin. Then apart from this one, the zearalenone, then T2 and fuminosin, which is produced by the fungi which are having the genus the Fusarium family. And aflatoxin is mycotoxin of the public health importance also, because it is carcinogenic in nature. In small quantity also, it may cause the tumor initiation, especially in case of human being. It is proved beyond the doubt that the aflatoxin M1 is secreted, aflatoxin M series, they are going to secrete it in the milk, and also thermolabile. That's the danger thing. In India, of course, most of the milk is boiled and later it's consumed. Even then, since it's of the heat stable in nature, or it is not destroyed in the normal pasteurization temperature. That's why there is a danger that the humans may get the carcinogen from the milk of the cattle. Hence, we should see that the cattle should not consume any such fodder which is leading to production of the mycotoxins. And The aflatoxin is the only mycotoxin in which FDA has imposed limitations regarding how much it may be fed in dairy rations, or else the FDA has, or the Food and Drug Administration of the US has fixed certain limits for every mycotoxins in case of the human food, whereas there is no standard for the quantity, exact quantity, how much daily intake is recommended for cattle. Now, the importance of aflatoxins and other mycotoxins is being known, and the scientists are also thinking in these directions. And of course, in the countries like Australia, US, Canada, and other countries, lot of research is being done on the mycotoxicosis of the ruminants. In India, till it is in the premature condition. Apart from one or few of the diseases, it is not noticed by the practicing veterinarians also. Many times it got unnoticed since the classical clinical signs are not there. The aflatoxin is a potent liver toxin and known to cause cancer in case of the animals, and also the FDA has established actions levels of the 20 parts per billion for grain and feed products, or the 0.5 ppb for the milk. That's the standard they have fixed for the aflatoxin. The aflatoxin effects occur in dietary levels much greater than that of the other day level and cause illegal or the milk residues. So the recommended maximum concentration in case of the total ration or the formulated food is 20 ppb in case of dairy cattle and cows, whereas it's little higher in case of the breeding cattle, that's 100 ppb. Whereas in case of if it is more than 200 parts per billion, then in case of dairy cattle, there is decreased performance over a period of time, long time, then definitely this will affect the production capacity of that particular animal. Whereas if the quantity exceeds more than 300 parts per billion, then it causes severe toxicity in case of the animals and also the dairy cattle. Some clinical signs will definitely, it will be exhibited by the animals. And the another toxin, the deoxynivalenol, or it's also known as DON, DON, is the proper name of the most often detected fusarium mycotoxin and often referred as the vomitoxin. And the DON in cattle has only been associated with reduced feed intake and lower milk production. That's all. Because the lower feed intake and lower milk production causes a great economic loss to the farmer, which many times goes unnoticed. And since it is not causing the disease which is going to cause the mortality or severe morbidity, the toxicosis is many times it is neglected. And the vomitoxin causes reduced animal feeding and the weight, especially in case of the swine. Of course, the ruminants are also susceptible at the levels as low as 1 to 3 parts per million. And pure DON added to feeds up to 66 parts per million in cattle and rations and do not result in the clinical signs. However, in the field conditions, DON has been associated with reduced performance in case of cattle at 1.5 to 2 parts per ration. Especially this study serves as an indicator of the spoilage and probably the presence of unidentified factors, especially more toxic than DON itself. Many other factors may be there. So the recommended maximum concentration in case of the total ration is 5 parts per billion in the total ration and 10 parts per million in case of grain. And it should not exceed 50% of the diet. That's the important thing. And many times, the types of the cattle are the beef cattle. Many times they are getting affected, whereas in India, all types of the cattle may be affected. And it's also one of the important toxin. Yeah, these are all the scenario in other countries and also India. We cannot get much more data, especially the mycotoxicosis is concerned. We have done from Department of Pharmacology and Toxicology, Veterinary College, Bangalore or Shimoga has done certain pioneering work, especially in case of the cattle mycotoxicosis. The reason how we came to this particular mycotoxicosis is, number one, in case of, there was a drought in case of 2003 in northern part of the Karnataka. The farmers fed the dried sorghum fodder of the previous year to their cattle and buffaloes. This happened in the northern Karnataka district like Haveri, Belagavi, then Dharwad, then this Bagalkota and Vijayapura districts. So in that year there was a severe drought which was followed by a mild rain, and the buffaloes and cattle ingesting such stale sorghum powder showed clinical signs of paraplegia, salivation, staggering gait and dyspnea. All these clinical signs were very non-specific, and they were not uniform in the entire what you call as the herd. Each cattle used to suffer from different type of the clinical signs. Some cattle used to have the Downer's cow syndrome also. Sometimes they used to have the kneeling cow syndrome or the nervous disorder, and also the weakness of the posterior part and the paraplegia. And similar cases were reported by ingestion of the fungal infected groundnut here in the various part of Karnataka state is concerned. So this made us to investigate into this particular problem, which is a very much economical important disease, and drastically there was a reduction in the milk is concerned, and in many of the cattle, especially the Hallikar and Amritmal cattle, in which they are not going to have the Downer's cow syndrome, and during the 2003 many cattle suffered from Downer's cow syndrome and many died also because of the maggots and etc. and secondary problems. Of course, we could get the particular fungi identified from the Department of Plant Pathology or the Mycology, University of Agriculture Sciences, GKVK Bengaluru, and they identified these fungi as Rhizoctonia, Macrophomina fasciolina, and then Aspergillus niger, Penicillium, and many more species were identified from the stale sorghum fodder. And this was the cause for that particular disease is concerned. And this is the fungus infected sorghum fodder, which was stale in color. It was having the black spots everywhere, and it was stored in a bund which was susceptible for the percolation of the water. Hence, many times this type of fodder was affected or infected by the fungus. Then the farmers offered the same fodder to all the animals in their cow shed because they didn't have any other choice rather than feeding these stale sorghum fodder. Then after 1 or 2 months and sometimes 3 months, it started the clinical signs, especially it was a burning problem of the Haveri, Dharwad, Bellary, Raichu and other areas of the northern part of the Karnataka. So all these animals were affected after grazing the fungal contaminated sorghum fodder, because sorghum was the common feed or fodder which is offered to the cattle very oftenly. Hence all these cattle suffered from such disorders which are having the non-specific in nature. Many times whenever the blood chemistry is done, there was decrease in case of calcium, and also there was decrease in case of the phosphorus, whereas the other parameters were normal. Of course, the kidney was functioning properly, the liver was functioning properly, and the organs were proper. But there was the clinical signs. Many times the lungs get infected due to the secondary bacterial infection, which was not a primary disease. There was severe respiratory problem, and also there was severe salivation. Then many times there was staggering gait, and there was a problem in walking, especially those cattle which are affected. And these are the fungi which are identified from the sorghum fodder, which was stale in color, and which it was having the black color, and it was infected with varieties of these fungi, Macrophomina fasciolina, Aspergillus niger, the Penicillium, Rhizoctonia, and many more species. They were there, and they affected particularly the cattle. And the clinical signs, much more clinical signs observed where the duration of the disease was about 15 to 20 days. It was this happens especially in case of mycotoxicosis, except in certain situations. Sudden mycotoxicosis or acute mycotoxicosis is rare in case of the cattle. If they consume the fodder which is infected with the fungi for 2 to 3 months in small quantities, then they will get infected. Whereas the disease was very much profound in case of the animals, especially the high yielders or the milk yielders, and it was also seen in case of the bullocks. Whereas the buffaloes are all equally affected, and there was excess salivation in these animals. There was hind limb paraplegia, then dyspnea, then sometimes vomiting, and hind leg edema was seen in most of the particular animal. Of course, all these clinical signs were obscure, and earlier it was diagnosed as the decrease in calcium may be responsible for such type of the non-specific clinical signs. And another problem was there was a fracture of the bones for small reasons also. The animals used to get the fracture of the humerus bones. So this was the additional factor that was observed by us in different animals. The animals, clinical signs of the mycotoxicosis, this is a Hallikar animal or the Amritmal animals. Indigenous animals usually very less susceptible for Downers-Coe syndrome. Apart from this, unlike this our crossbred animals, then most of the animals do have the posterior paralysis, unable to get up, and they used to struggle to get up. That was one of the classical clinical signs observed in most of the animals, and this indicated that there was a nervous problem in this particular cattle are concerned. And other clinical signs affected with the different animals, like there were diarrhea followed by a severe constipation. Then the animals used to micturate frequently. The rectal temperature was very much normal. Then the normal mucous membrane without any afferent changes. Either there was no what you call as anemia or any change in the mucous membrane color. Most of the animals were suffering from the anorexia and total feed refusal in many animals. I think the vets may be observing such type of the clinical signs, and if such signs are there, then please suspect the fodder as culprit and check it for its quality is concerned. And one of the fungi what we have isolated from that particular grass was the Macrophomina fasciolina, a fungal phytopathogen, infects about 500 species for the worldwide. And the tropical crop plants are seriously affected by this particular pathogen is concerned. And this Macrophomina fasciolina produces a number of phytotoxins or the mycotoxins, namely aspergillin, isoaspergillin, then pomalactone, fasciolinic acid, pomenon, and fasciolina. And so see, a single fungi is going to produce such huge number of mycotoxins, and there were the multiple infestation of the fodder by different fungal types. Hence, it's of a serious concern, especially the fasciolinon, a major phytotoxin. It's produced from the Macrophomina fasciolina, and it causes the clinical signs like the nervous problems. And fasciolin facilitated the infection by the human and animal pathogen, especially the Aspergillus fumigatus, and which is not normally a phytopathogenic. And by reducing the immunity of the germinating seedlings, all these were created. And independent animal toxicities, of course, it is not done. The Macrophomina fasciolina and many more, of course. The individual toxicities, especially in case of the laboratory animals and inducing the disease and studying the pathogenic pattern, is not done. Whereas this Aspergillus niger is one of the very commonly occurring phytotoxins, and these Aspergillus flavus commonly occur in the environment as such. So they will be there and producing the moderate quantity of the mycotoxins, especially in case of soils and decaying the vegetation. But a number of species are also closely associated with the human and animal food, particularly cereals and nuts are being affected with Aspergillus. One of them is the malformin and the oxalic acid are the two important toxins which are produced by the effect of the Aspergillus niger. And of course, the Aspergillus niger is going to produce the malformin, and it is going to stimulate the production of the oxalic acid from the feed. So the rhizoctonia is another thing which causes the black patch disease, especially in case of the horse. On the muzzle and other body parts, there is the patches are seen, and many times this type of the disease is confused with that of the dermatological disorders, which are caused by so many type of the organisms, and also the cause is different. And this rhizoctonia is formed during the wet and humid weather, as usual in case of the other mycotoxicosis is concerned. And the subclinical toxicities, many times they goes unnoticed, as I have repeatedly telling that one should always watch the fodder quality, because it may not cause sudden death, but causes severe economic loss, and sometimes the repeat breeding, sometimes the low SNF, and sometimes the anorexia. And if it is more severe, then the animal may die also. So one has to observe about the subclinical toxicity. Then this is a non-spore former and survives 2 years on infected seeds and 10 monthly for the hay. So apart from the fodder, then the feed, then the grains, then the millets, and many more type of the feed ingredient which is offered to the cattle are being affected with the mycotoxins. Especially in case of ready-made feeds, if multiple ingredients are infected with the fungi, then there is a chance that these cattle will suffer more and more due to the multi-mycotoxicosis. Whereas in case of cattle, this always happens. Many times the multi-mycotoxicosis problem is a very common thing, because varieties of the fungi are going to grow on a particular pod. It may be a maize, it may be a sorghum, it may be a paddy straw, it may be the husk. That's why we have to be careful, especially the multi-mycotoxicosis diseases. And one of the important this fungi which is affecting the fodder, especially the sorghum fodder, is Rhizoctonia leguminicola. Of course, many more than 20 type of the fungi will affect the Rhizoctonia, especially the sorghum fodder, whereas the Rhizoctonia is one of the important thing. In that, Rhizoctonia is a very big species, and the Rhizoctonia itself, the Rhizoctonia leguminicola, is one of the important fungi. And we can culture them on the potato dextrose agar and get them identified by the plant pathologists, and this is going to produce two indolizidine alkaloids. The number one is the swainsonin, or it's also known as locoism, and slaperamine. It causes the salivary syndrome in most of the cattle. Ultimately, most of the cattle in the Haveri or the other district, 3 or 4 districts where we have done the survey, they were all having the salivary disease. There was profuse salivation from the mouth of these animals, hence the slaperamine may be one of the important ingredient. So both of this swainsonin and the slaperamine are synthesized from the L-lysine as per the review of the literature. So the slaperamine is one of the important toxin, and it's a potent muscarinic exocrine secretagogue, and there is no hemodynamic and neuromuscular effects are seen, because the muscarinic effect means the acetylcholine level will be increased, especially in case of the exocrine gland like the salivary gland and the glands of the particularly the intestine, etc., they produce lot of secretions. Of course, there are no changes in the hematological or biochemical parameter, and these sulforamine has got very high affinity towards the salivary gland. Hence, the cattle which are affected with the mycotoxicosis induced by the fungal infected sorghum fodder do have the sulforamine, and especially the LD50 and other things were also conducted, especially in case of broiler chicks. It is highly toxic. 81 milligram per kg causes the toxicity in case of the chicks. And mortality of chicks is reduced by atropine sulfate in experimental situation, because in large poultry farms it is very difficult to inject the animal with atropine or any other thing. Hence, there is no other choice than the replacement of the feed or fodder which is offered to the poultry or cattle which are suffering from the mycotoxicosis. And the sulforamine is also a mycotoxin from the sorghum by Rhizoctonia species. A single fungal species may also produce multi-mycotoxins, or different species of the different fungi will produce different mycotoxicos. Hence, the multi-mycotoxicosis problem is one of the important problem due to the fodder infected, consumption of the fodder infected due to the different fungi. And the mechanism of the toxin is of course, it is going to act on the cattle, horses, and sheep. These are the susceptible species. It doesn't mean that the other species like goat and other animals do not suffer, but they also suffer in higher doses. So the mechanism narrated is it is going to react with the acetylcholine receptor or the cholinergic receptors at exocrine gland, especially on the muscarinic type of the receptors. And once again, it is going to increase the salivation, increase the secretion of the gastric juices, and hemodynamic and other changes are not there. Of course, the clinical signs are the salivation, lacrimation, the urination, many times the diarrhea and dyspnea, and occasionally bloat and death have been reported in case of cattle. So, my humble request to the audience veterinarians is, whenever we are observing any disease in case of a large animal, please check the fodder or feed offered to that particular cattle and cut open that particular feed or fodder. Please check for the presence of the fungi. Many times dark powders, many times brown powders, and sometimes there are dotted spots will be present, and it is indicative of the mycotoxins. So, the animal may be suffering from a disease which will not be of serious nature, but it affects the animal's health to a greater extent. So, one should be careful, especially while treating the animal with the mycotoxicosis is concerned. And especially the sulforamine causes toxicity in case of the horses. There is continuous salivation will be there in case of horses, and also lacrimation periodic, and many times you might have observed there is continuous lacrimation in cattle or buffaloes. Of course, in case of buffaloes which are infected with the fungal infected mycotoxicosis, and sometimes the frequent micturition and diarrhea, all these non-specific clinical signs will also be seen in case of the cattle. And in such case, please change the fodder which is offered to the cattle. And sometimes there is persistent, what you call as the prolapse. In many buffaloes, there is persistent prolapse. If there is a persistent prolapse, please change the feed. Then the problem may subside, because the sorghum or the maize or the paddy straw which is offered to the cattle may contain the zearalenone or also deoxylevanolone. Both of these are estrogenic in nature. And in case of pregnant animals, we can see the abortion, and there is stiff joints. There will be stiff joints, and Horse and ruminants and guinea pigs are sensitive to the sulforamine toxicity. So these are all these sulforamine and other toxins are the rare mycotoxins which are secreted by the varieties of the fungi, which are not a routine mycotoxins like aflatoxins or the T2 toxins or aflatoxins. So the pathological findings, if we cut open the carcass and other thing, then we can see that the blood vessels in thoracic and abdomen cavity are engorged with the blood, and the lungs will be very much enlarged, and there will be emphysema. Then there is a pulmonary edema. Submucosal glands of the trachea will be very highly active, and a lot of secretions will be present because of the muscarinic activity of the cholinergic type of the receptors. Whereas in case of liver, what we can get is centrilobular necrosis in case of the microscopic anatomy. Then the kidneys will be congested in most of the mycotoxicosis. Of course, the liver is affected, the kidney is affected with that of the fungi. So, whenever more than 1,000 cattle we have examined, and the problem could not be attributed to a single fungus, but it was due to the complex cumulative effect of many mycotoxins or the multi-mycotoxins. So it was important, especially in case of the northern part of the Karnataka, and caused severe economic loss in terms of the drop capacity of the animals and also the milk production, especially in case of the dairy cattle and also in case of the Hallikar animals. And further research was very much required in this particular thing because it was a rampant, and many times it was misdiagnosed to certain other diseases like this hemorrhagic septicemia, then or the hypomagnesemia, hypocalcemia, and the hypophosphatemia, because there was hemoglobinuria was also present in many of the animals, and this was one of the important just like the endemic epidemic at that time in case of many of the northern Karnataka. So the treatment always the farmers or the owners and also the veterinarians ask what treatment can be done to such mycotoxicosis is concerned. Means if a sorghum fodder is affected with the infected with the fungi and offered to the cattle, then if the animals are showing clinical signs, then what can be given? Then atropine or propanthelin may be given if severe salivation is there. Just it's a symptomatic treatment, preventive and curative in the initial stages. But in the later stages, it is not responsive well, because many times the gland becomes paralyzed also. And in case of the downers animals, we can administer potassium acetate at the rate of 25 milligram per kg as 10% IV and 100 milligram per kg orally twice a day till the animal recovers. So usually the downer animals, especially they will recover if the fodder is changed, and continuously the B complex vitamins need to be administered, especially the B1, B6 and B12 are required as a nervine tonics. And apart from this one, the antihistamines could be of some help, and the most effective method is replacement of uninfected forage. Of course, whenever there is a mass spoilage of the forage, then it is very difficult. The farmers will ask you, sir, from where I can get the fodder, because the entire district or entire area will be infected, especially the fodder will be spoiled. So at that time, what you can advise to the farmers, if you suspect the fodder is not good, you can cut open the particular fodder into smaller and smaller pieces and sprinkle some salt water, especially 1% salt water should be sprinkled on the particular grass and dry it in case of the open sunlight. And after drying, if it is unavoidable, you can feed that particular fodder to the cattle. How it helps is the spore forming mycotoxins, especially the fungi, they are not going to germinate, and they will they will not cause the toxicity. So, of course, the replacement of the fodder is the only alternative for such type of the diseases are concerned. And this is another episode in which we have seen that in case of Shira of the Tumkur, we have observed a very characteristic disease in which the clinical signs were having especially the clinical signs were having the hemorrhages in the intestine. There was very difficulty in the what you call as the defecation, and many times there was uninterrupted bleeding was there. And later we could attribute that thing to the consumption of the groundnut hay, which is affected with the fungi. And this is the fodder what you can see here from the Shira taluk of the Tumkur district. And here also the farmers they fed the stale groundnut hay to the animals, especially the Amrit Mahal animals or the other animals. The buffaloes they very less affected, whereas the all other animals were affected to the extent of more than 250 animals affected in that particular village. And later we have isolated the fungi which is contaminated, this especially the groundnut hay, and later the following samples were examined, and the fungi isolated were belonging to the different species like Macrophomina, Picinia, Cercospora, Aspergillus, Rhizopus. So all these species, many of the species may not secrete the mycotoxins at all, but in the adverse situation, they are going to secrete the mycotoxins. See, each fungi here is going to secrete multi-mycotoxins, and if you combine all the mycotoxins, it is going to cause the severe problem, especially in case of the affected animal. And here you can see that there are hemorrhages in the conjunctiva of a bullock, which is not a common, what you call as the common clinical signs. But in the Shira, there was a mass, what you call as affected animals are there. Many animals were affected with the clinical signs of the hemorrhages throughout the body, inside the intestine. Then there was a melena and many more type of the disorders. Whereas, of course, most of the animals were debilitated, and of course they are dehydrated, and we could see that hemorrhagic conjunctiva was there, and also there was anemia, what you can observe by this, by the mucous membrane of the bullock. Especially the Hallikar and Amritmal bullock were affected with such characteristic hemorrhage, especially on the conjunctiva in case of a bullock. Of course, many more such species were affected, and of course we could examine the few. There was this ecchymotic time of the hemorrhages in the conjunctiva of the bullock was seen, and there was anemia, especially due to such type of the hemorrhages of the tongue in case of a bullock. Entire body there was hemorrhages, and the particular disease was being suspected as anthrax in case of the cattle also, because this was the clinical signs: bleeding from the rectum of a bullock which is affected with the fungal infected groundnut hay. Fungal infected groundnut hay causes such disorders. From the rectum we can see the bleeding, just like anthrax. Many times it was confused to the anthrax, as many animals died there, and of course the anthrax organisms or the natural habitants, the veterinarians got confused there. Yes, they were trying the vaccines of anthrax, and many times they also suspected some poisoning, especially the rodenticide, which is not a possibility because almost all the animals cannot be affected at the same time. That's one of the important thing. Yes. Here, if we examine the mucous membrane of the rectum, there was a hemorrhage, indicating that the particular mycotoxin which is present in that of the fungal infected groundnut hay is having hemorrhagic in nature, especially the mucous membranes. All the mucous membrane where there were a lot of hemorrhages, which is indicating that there is a damage to endothelial cells of the capillaries are concerned. This was a very characteristic feature in most of the animals that the farmers have observed. In the Sira Taluk, this was an episode during the 2010. Then at that time they observed that whenever there is a fly bite, the hemorrhage should stop within 2 to 3 minutes because that's the clotting time. Whereas in such animals, whenever there is a bite to the scrotum and thin skins, the bleeding never is to stop even after 11 minutes also. So this was a characteristic finding there. That means the mycotoxin which is present in that groundnut hay was having anticoagulant property. So then later we procured this particular fodder. Of course, Dr. Vinay Tikare is the person who has pioneered in this particular area. He was the PhD student at that time, and he worked very hard to isolate and identify the fungi. Of course, we could take the help of the Fusarium Research Institute, USA also, along with that of the Agarkar Research Institute, Pune, and of course, all these were cultured under the potato dextrose agar, and later they were identified by the experts in this particular area. And one difficulties to us, which was faced by myself and Dr. Vinay, it was the identification part of this fungi was a tough part really, because many times the fungi which are affecting the suppose there is a productive part, especially it's a fruit or it is a nut in case of a plant, then it is always drawn the intention of the plant pathologist. Whereas once it is cut and thrown out and later it is affected with the fungal infection, then it is least bothered. The scientists are not worried, especially the plant scientists are not worried about the fodder infecting, the fungi infecting the fodder. Whereas the veterinary scientists, they are very much experts in case of identifying the disease caused by the fungi, especially the dermatological disorders and the claw hoof disorders and many more fungal disorders. So this was a very big challenge for us to identify this particular, especially the new type of the fungi were there. And of course, we could identify them as the Fusarium spirotrichoides. So identified, and later they were cultured on the potato dextrose petri plate, then cultured in case of the tube. Later we have mass cultured them in case of the laboratory glasses. Then we have extracted them in case of the wheat also. Then these were offered to the mycotoxin level in these particular different mycotoxins. Of course, the multiple mycotoxins were present in the stale, what you call as the stale groundnut hay was there, and we could identify many of them using the LCMS and MS facility which was present with us. So the multi-mycotoxins were analyzed, and it was decided that the cause of the disease is not a single fungi or the mycotoxin. It is caused by varieties of the mycotoxins, and it is the combined effect. Of course, we did an experiment on the rat by feeding the extract of that particular broth and administered it to the rats, and the rats died exhibiting the similar clinical signs which was exhibited by the cattle. Hence, we concluded definitely that the fungi has caused the disease in case of the fodder. It has spoiled the fodder, and later it has excreted the mycotoxins. Then the mycotoxin containing groundnut hay was consumed by the animals, and they were suffering from such disorders. which could be reproduced in case of the rats. So this was a PhD work of Dr. Vinay Tikare, who has organized this particular seminar, and of course it's a very good contribution to the veterinary field is concerned. Later we suspected a lot of this special mycotoxicosis in Karnataka state, because at that later we started suspecting that the XYZ disease might also be due to the mycotoxins, mainly mycotoxins, or sometimes it is the mycotoxicosis was a coexisting diseases. So by this we could explore many more disorders. So the very typical lesions, especially the hemorrhagic lesions, were also obtained in the limbs of these particular rats, which were administered with the extract of that mycotoxin containing broth. So here you can see that there was a death in the rats due to the internal hemorrhages. That was especially vitamin K analogs were also antagonists, were also seen there. And the another thing is, this is about the fungal infected Donate in such toxicity. What is the line of the treatment? So here important thing is there is lack of clotting factor, so we can administer transfer the blood transfusion also. Many times this vitamin K analogs, or many times Menadian sodium bisulfate we have used with the partial success, because on the entire body there was hemorrhage, and it was very difficult to see, and there was severe anemia was also present. Hence, in such cases we have to stop the feeding such a fodder to the animal and replace it with a new fodder, and later treat the animal with the blood transfusion, or the blood clotting factor need to be administered, or the ferrous or other things, symptomatic. Totally it's a symptomatic treatment. There is no specific antidote for this particular mycotoxins are concerned. We have to treat them very symptomatically as per the symptoms. So another thing is, the meadow grass is one of the wild grass grown in the North Kannada district, the Dakshina Kannada district, Udupi and Chikmagalur, Shimoga districts. It's one of the non-specific grass. It's called as the meadow grass, which is grown on the empty open area. Then it is usually infected with Penicillium species. You might have heard that Penicillium notatum, from which we have isolated the secondary metabolite penicillin by the Alexander Fleming in 1928. But the fungus, of course, if you administer the mycotoxins more and more, definitely it will cause the mycotoxicity. The other species were yet to be identified, of course, the meadow grass and many more grass. We have to have the culture, and we have to procure it, especially the feed and fodder, from the disease caused stock only, or else it will be infected with so many other non-specific these fungi also. So the effort to induce the toxicity, of course, the laboratory animals like rats, rabbits and guinea pigs, after administering the fungus, it's being done, and of course a few of our MSc students have done this particular work and proved beyond doubt that the meadow grass is having toxicity, especially in case of the buffaloes. So the groundnut hay, especially the Fusarium spirotrichoides, which secretes apicidin and vioracin, and this Fusarium semitectum, it secretes apicidin and also the vioracin, both Rhizopus or rhizae, which is affecting, it is going to secrete the citrinin. So all these are combinedly going to cause the mycotoxicosis. And a buffaloes are always affected very fastly, and they are susceptible to the mycotoxicosis is concerned, and they get affected after consuming the meadow grass, especially in Siddhapur area of the Uttar Kannada district, and the dominant species was the Penicillium. Of course, if you put the grass outside, a lot of fungi will grow after 2 or 3 days on it, but varieties of the Penicillium species were there, but the few of them were secreting the pathogenic mycotoxins. And of course, the animals had the wobbling gait, and they were suffering from the Downer's cow syndrome, which were the buffalo calf here shown were affected with toxicity after consuming the meadow grass is concerned, and it was containing fungi belonging to Penicillium species. So there was a wobbling gait and all other clinical signs were there, and the animals had a very weak body structure, and the body condition went very bad. Of course, there was partial feeding was there, of course, but they were having the Downer's cow syndrome and wobbling gait. Especially the milking animals had got more diseases. Here you can see that we had administered the potassium acetate. Of course, the potassium chloride is the one which is going to supply the potassium, which is a part of the generation and suppression of the action potential, especially in case of nerve conduction. So the potassium chloride is highly toxic, whereas the potassium acetate is not comparatively toxic, high toxic when compared to the potassium chloride. So this can be used as 10 milligram per kg as 2.5 solution, especially in case of dextrose normal saline. Slow IV should be given, or else if you give fast IV, many times the animals may collapse also because of the cardiac suppression action of the potassium acetate. So one should see all these aspects and go. If you cannot give the IV, then please give the potassium acetate orally, about 30 grams to an adult cattle, 10 grams to a buffalo calf, so that after 4 or 5 days you can get the results, especially the animals try to get up. And this is another episode of the toxicity, especially the fungal infected paddy straw, especially in Dakshina Kannada district. It was especially seen in case of Bantwal and other areas. And now also this type of the toxicity is coming, and please report us any such toxicity to either me or to the concerned vets. The farmers should always report such type of the clinical signs to the veterinarians, and the veterinarians in turn can inform us. The clinical signs, especially in these buffaloes, where they used to kick their bellies, and it was a sign of the colic, and the intestine, there was a pain in inside the abdomen or the intestine, hence the animals used to have the tenesmus, especially the sucking up of the air from the anus, because to cool the intestine or to reduce the suffering of the intestine, I think they were doing all these clinical signs, and they used to die in spite of the treatment, because by the time what we are able to diagnose this particular disease, it might have progressed, so that there was hemorrhages, etc. So then we have treated these animals with antispasmodics and other thing, but with very less success. And removal of the straw, especially the paddy straw, with that of, or the replacement of the paddy straw infected with the good straw, gave a good result after 10 to 15 days. Not a fast recovery occurred, especially in these animals, and offering the green grass and good type of the concentrates made the animal to recover very fast. So when we have conducted the post-mortem of this animal, there were severe hemorrhages on entire intestinal loop, and there was also the rectal bleeding was present. And a few of these animals, they were also having the bellowing, and many times the bellowing and tenesmus makes us to suspect it for the rabies also. So from these particular paddy straw also, we tried to isolate the mycotoxins which are infected the grass, and of course we could isolate many type of the mycotoxins from this particular the thing. And this is another episode in which there is a very strange episode, especially it occurred especially in the Roon Taluk of Hubli, and very high incidence of the fractures in case of the bullocks. Of course, we can we call it as the outbreak of the fractures or not? it's a question mark, of course, because in a single village there was the fracture more than 20 animals which were consuming the stale maize, etc. So particularly the humerus bone used to get fractured in this particular disease is concerned, and the animals were examined for thoroughly for the fracture and etc. in the other part of the bone, but we could not get any such type of the fractures in other part. Initially, what we have suspected is there is the deficiency of the calcium, which was also evident with the biochemical testing, but no other bones were involved. Only humerus was involved, and there was a fracture in humerus, especially in case of bullocks. So then we suspected this as the mycotoxicosis and started searching the source of this particular disease is concerned. And we collected the humerus bone from the slaughterhouse, and there was an oblique fracture in that particular bone is concerned. And there was an oblique fracture. Of course, it was having the strength, but it was porous inside, which is indicating that a particular mycotoxin has secreted from that sorghum maize, and it has replaced the calcium and also caused the porosity of the bone. And since humerus is the bone, especially in case of bullocks, it is one of the weight-bearing bone, hence it has been fractured. And this was the fungal infected sorghum fodder which was fed to all these animals which are suffering from the fracture. Of course, they ended up in case of slaughterhouse, because once the humerus fracture is there, it's impossible to repair it, of course. Then we went to the field where this maize sorghum straw is harvested, and we could see that about 1 month back there was a rain in that particular area, and all the grass were infected with the fungi like this, the fungal infected sorghum straw. You can observe that the color of this particular grass has been changed from the white to dark brown and sometimes very black in color. So the farmer should never feed such type of the sorghum fodder, because it contains a mycotoxin which is going to cause the fracture or the porosity of the bone. Of course, we could see the bones, the bone matrix was very much having the lack of the matrix, and there was the bones were porous in nature, which was very susceptible for the fracture. And the fodder is affected with the fungi was because this is a black cotton soil, and cotton was grown in this particular area, and along with the cotton, the fodder was also grown, the sorghum fodder, and from this particular, especially the stem, along with the stem, the grass was cut and offered to the cattle. So this stem also went inside the stomach of the animal, released mycotoxins, and caused the severe fractures in case of the cattle. The purpose of putting all these things here is that the mycotoxicosis is one of the most important cause of the disease, especially in case of the cattle, which is neglected totally. The buffaloes in that particular village had also consumed the same fodder, but never suffer from the fracture. The farmers were asking the same question: "Sir, we have fed the same fodder to the buffaloes and also to the bullocks and also to our dairy cattle, but the fracture is only observed in case of the bullocks. What may be the reason?" So here the simple logic behind the fracture is the buffaloes and the dairy cattle are not used for the plowing purpose or pulling the cart purpose, and there is no exercise or the work to them which could bring a lot of pressure or the tensile strength on the fracture, especially on the humerus bone. So the bullocks are the one which are going to pull the cart or use it for plowing purpose, hence the fracture was there. So this is the answer what we can give. I could with other. These animals might have also been affected. Their bone might be porous also, but since they are not used for the plowing purpose or any tough process, they are not affected. And here you can see that in between this cotton field, this is a cotton crop, and in between this particular crop, this type of the what you call as the grass was grown, and in the rain, all these were infected with the fungi. And later, after lot of inquiry, they told that yes, we have fed the bullocks with this powder only, sir. So we could suspect that the particular fodder is responsible. There was no treatment for that particular thing is concerned, and only what we have advised is administration of calcium borogluconate, dicalcium phosphate, mineral mixture, and along with that particular thing, the supporting treatment like B complex vitamins, etc. are suggested. Because once the clinical signs develop, there is no use in giving the activated charcoal to these particular animals are concerned. Hence, we could say them, please stop the feed further, stopping the feed, so that we can see that the fodder is not going to cause the further harm. Yes, this is another syndrome. What we have observed is my friend Dr. Holepagol, he has referred us a cases that some animals were kneeling on their front leg, and this is a position in the weight rests on the knees. I will show you the photograph. The condition was observed in the animals, especially in case of Mudhol and Jamkhandi area of Vijaypur district and the Bagalkot respectively. It's a peculiar disease of the buffaloes of the northern Karnataka, and the animal could get up with lot of difficulty and used to stand on its knees with elevated hindquarters, and noticed during the late rainy and early winter season. And the dystrophy of the skeletal muscles was a characteristic clinical signs in all these buffaloes, and there was especially the buffaloes were infected to the greater extent when compared to the cattle. And abdominal type of the respiration was also noticed, and the scapular spines were very much prominent, and the muscle which is present on the spines were atrophied, and there was a generalized weakness in the animal, especially in the front part. So in this is a very peculiar, especially these were infected with, this is the kneeling syndrome what we could get in that particular area. Most of the buffaloes in this area were reluctant to get up, and they used to stand in this particular position only, and with great difficulty, if we could make them to stand, then there was a what you call as the very tough gait, and they never used to walk ahead and reluctant to move forward, even though the farmer pulls the animal up. After getting up, the animal, the scapula and other thing, you can observe that it is having atrophy of the muscles. So this also we are suspected the mycotoxicosis, because it was not at all responding to any other treatment, and no microorganisms could be isolated from this particular animal also. Then it was a definite case of the mycotoxicosis. And many animals, you might have seen that especially in this area, wither or rump or the loin region, there are lesions, especially the dermatological disorders, and many times this is also due to the mycotoxicosis also. So here dermatological disorder which is not at all responding to any medication, maybe the zinc or sulfur or the other supplements could not make the animals to recover. All these type of the clinical signs were seen in such animals, and the varieties of types of the disorders, fungal infected. So many times the buffaloes, they especially the knee joint and other thing, there was a wound and which was never used to heal, and ultimately it was suspected that there is a mycotoxicosis problem in these animals, and it is induced by offering the fungal infected fodder, maybe of any origin, maybe the paddy straw, or maybe the maize straw, or maybe the sorghum straw. So such type of the dermatological disorders were also observed in case of mycotoxicosis, and many times the fungus was isolated as the fusarium. And we have also seen that tail and ear gangrene was seen in case of buffaloes, especially in bullocks and other cattle. The tip of the tail and it dries, and subsequently the gangrenous tail drops off. And in some animals, concomitantly there will be drying and loss of the tip of the ears. And from the feed and fodder samples, there was no evident claviceps purpurea, because once upon a time this disease was diagnosed as the Deg Nala disease. Maybe the Nala, where in case of Punjab and Haryana areas, this was diagnosed as the Deg Nala disease. Many told that this is due to the selenium toxicosis, and few told that this is due to the mycotoxicosis, which was a correct diagnosis. Yes, hence this condition was not due to the ergotism is not the cause. It was attributed to the fungal infected paddy straw consumption. Yes, we could get that there is the tail gangrene in these particular animals, and also the tail, there was a deformity in the extremities, especially in the ear. The ear was very dry and about to fluff off also. So we could isolate the variability of the mycotoxins. And another incidence is mycotoxicosis due to consumption of fungal contaminated maize straw. HF and Jersey cross, they exhibited clinical signs of the loss of body conditions, ruminal atony, severe anorexia, all these recumbents, non-specific clinical signs, and hyperapnea, abdominal type of the respiration, dry muscle and nasal discharge, and abortion, especially in case of pregnant cattle. And we have observed this particular thing, and also the hemorrhagic spots on the facial region was also observed. And the mycotoxins secreting fungi are the Fusarium oxysporum and Fusarium subglutens. So, and also the Aspergillus niger were observed, and respective mycotoxins were causing such type of the mycotoxicosis. This was the fodder. Of course, looks very good from the far away, but if we go close to this particular fodder and examine, that it was having the stale appearance, and feeding such fodder for prolonged duration will cause the diseases like the staggering gait, and also the muscle, there was a cracked muscles. Of course, you can see the specific type of the lesions here. It may not be a serious or life-threatening condition, but there was a drastic reduction in the milk yield. The animal used to give a milk of 15 liters and suddenly it dropped to 5 liters. So it was a great economic loss to the farmers are concerned. And this is the cattle observed in case of the Ravi Shankar ashram. Lot of gir cows were there, and they were suffering from a characteristic dermatological disorder in which there was a tail gangrene, and there was the lesions especially present on the limbs and also on the pendulous ears of these animals. You can see that a specific alopecia or the then there was no itching at all, even though these animals have suffered from many diseases. About 200 cattle suffered there, and we could see that some of the animals, they developed such type of the lesions, and many times in few animals we could see that the tail gangrene was also a characteristic feature of this particular disease. And later, after assigning all the causes and differentiating the disease, we could see that it is due to the mycotoxicosis from a fodder which is procured from the Gujarat area. It is an unusual fodder. During the transport, it has been wetted, then in a rain, then affected with the fungi. And after replacement of this particular treatment, this fodder and treatment with sulfur and zinc, we could get the very good results, especially in case of those cattle. Yes, of course, we could analyze the feed and everything, and we could see that there is a decreased calcium And apart from this one, you can see the necrotic rings on the tail of the buffalo with tail gangrene, and it is successfully treated with administration of the sulfur and zinc. So these mycotoxins may also replace the sulfur and zinc containing amino acids as per the literature and might have caused the toxicity. So here many times we can see that the lesions like this tail necrosis and tail has lost the hair, and many times the tail has fallen off, and all these are attributed to the mycotoxins, none other than mycotoxins. And the treatment is totally symptomatic and the replacement of the fodder. You can see here many type of the fungal infect necrosis of the tip of the tail in the buffalo due to crush injury also seen, and this is a definite mycotoxicosis induced tail necrosis, especially in case of the fusarium type of the necrosis is also seen. And many times in the case of feed and industry, such sorghum or maize which are stale or rotten in nature, there is a habit that crush all these things and feed it to the cattle. And in such situation, the animals are always affected with the varieties of the disorders, especially the T2 toxin it may contain, especially the health on the totally overall health of the cattle, especially in case of ruminants, is totally they are going to cause the decreased feed intake and also the lameness, then milk contamination with that of the aflatoxin, then the zearalenone, irregular heats, low conception rate, ovarian cysts, prolonged stress, abortions, and low testicular development. All these are very well documented. Hence, we should be very careful while handling this particular thing. And aflatoxins, of course, it causes all the carcinogenic effect and also the gastrointestinal effect, residues effect, and so many disorders. There is a higher incidence of cancer in case of the exposed animals, the horn cancer, the squamous cell carcinoma, and interdigital condyloma. All these things are seen, especially due to the aflatoxins, and there is a decreased resistance to the disease, especially the environmental and microbial stressors, and increased susceptibility to the diseases. And of course, there is a decreased performance due to the decrease in feed intake and milk production and weight loss and reduced weight gain. Of course, the pathological changes are seen that increased liver weight and kidney weight. Of course, the hepatotoxic effects were liver damage in the histopathology. You can see in case of gastrointestinal effect, the rumen was impaired, there was sluggish movement, decreased cellulose digestion, volatile fatty acid and formation was seen, and proteolysis and rumen motility, there was a diarrhea also. And many times the diarrhea occurs due to the mycotoxins also. Residues, especially aflatoxin M1, will come in the milk and cause the public health hazard. So, the residues decrease bleeding efficiency, then birth or smaller and unhealthy cattle is also seen, and acute mastitis. And trichothecins are also seen in this particular animal. Trichothecins are seen especially in these particular animals, and all these non-specific clinical signs like the immunosuppression, decreased resistance to the microbial infections, etc. are seen. The decreased performance, especially the recurrent gastrointestinal disturbance was also the problem. And the dermal effect, inflammation of the mouth and lesions and neurotoxic effects. All these effects will be induced by trichothecins. And of course, the zearalenone are also some of the mycotoxins which going to cause the toxicity of the reproductive tract and also the infertility, decreased conception rate, and teeth enlargement and other secretions, and decreased milk production. Of course, the ergot alkaloids are producing the neurotoxic effects like the occasional convulsions and reduced fits in case of the feed intake. and the decreased performance is also seen, whereas the reproductive effects of the ergot alkaloids are the abortions. Most of the time, the abortions are seen. If you observe recurrent abortions in a particular herd, and which is negative to the brucellosis and other infectious disease, please suspect it for the ergot alkaloid toxicosis, which is due to the mycotoxins. And the pathological changes, there is a lameness always in some cattle shed we have observed. That's chronic lameness and necrosis of the abdominal fat, and the diarrhea may be present. And please suspect the mycotoxicosis. So coming to the final part, that's the conclusion of this particular mycotoxicosis part is it's a common problem in case of livestock. Karnataka and entire country, which is not at all recognized by the veterinarians and also the practicing persons and the farmers. Many times they neglect this part, and many more diseases apart from our observations are also observed by the many scientists in other part of the world. Of course, we have to document these diseases to the greater extent, and many diseases are suspected to cause due to the mycotoxicosis. Of course, it may be a disease of the infectious nature, but the causative or the agent which has suppressed the immune response may be the mycotoxins, and buffaloes are more susceptible to mycotoxicosis in case of Karnataka state is concerned when compared to the cattle. And many fungi and mycotoxins are yet to be identified, and a lot of work need to be done in this aspect. Especially it's the responsibility of the veterinary toxicologists to identify more and more fungi and isolate and identify. And of course, there is a necessary to establish the toxicity in case of the laboratory animals, so that it's an evidence for us and necessary to find suitable remedial procedures. Especially we cannot how to make the fodder the pathogen free or the mycotoxin free. It's one of the biggest and toughest task, and as far as possible we have to avoid feeding such stale fodders always to the cattle. So even though they do not cause the acute or sudden death, they may drastically reduce the health status of the animal and production status of the animal. And the fungal infected fodder, or they should never be fed, and if it is totally unavoidable, then we can cut upon these fungal infected fodder and dry them properly. Then you can feed with the mineral mixtures and other things. That also we have conducted some trial. Of course, the administration of activated charcoal or the toxin binder is of no use in case of in such cases, because the ruminants especially they consume this fodder for a prolonged period. So every day it's impossible to administer the activated charcoal or many other commercially available toxin binders. Hence, we have to advise the farmer not to feed this thing and not to feed the fodder which is infected with the fungi. And of course, this is the end of this particular slide. And I thank the organizer, Drs. Vinay, Dr. Vijay Kumar, and Dr. Prashant Wage for giving me the opportunity. And thank you a lot. Yes.
Thank you very much, sir.
Okay.
You have delivered a very exhaustive information of the lecture and shared a very informative information regarding mycotoxicosis, and it's a field applicable part what you have shared, sir, and it's helpful for the practicing veterinarians. And actually, the mycotoxicosis in ruminants, it's actually neglected area, sir. But much scope is there for the research purpose. But educating farmers regarding this mycotoxicosis is very much important. And as such, already I told, there is no any specific treatment. It's only the symptom treatment what we can follow. Otherwise, at least we can replace the contaminated feed or fodder with the better feed or fodder. This is the only solution for treating such mycotoxicosis, sir. Thank you very much, sir. Any questions from the audience? As of now, there is no any questions that they have asked. We'll wait for a second. Vijay sir, let's conclude.
No problem from my side.
Okay, sir.
There are no
Thank-
questions. Thank you, sir. Thank you for sparing your valuable time. And if any questions are there, we'll share them with you,
Sure,
and we'll
sure.
share your
Thank you.
email ID with the participants.
Okay.
Thank you very much, sir. Thank you, sir.
Thank you.
Okay. It's all from the organization. Thank you for the
Okay, thank you so much for giving me the opportunity and organizing such a good series of the seminars. Starting from the day 0 also, it is coming very well. I do not know how much the people are going to appreciate this thing. Anyway, any feedback, please convey it to me so that I can improve it further with the research and other thing also. So please take the feedback of the stakeholders and convey it to me. Thank you a lot to all the organizers.
Thank
Thank
you,
you.
sir. Thank you, sir.
Let me leave.